Hi there everyone, this is Adrien, the exercise specialist from the Leduc Beaumont Devon Primary Care Network. Hope you all are doing well today. For today's video, I thought I'd show you guys a quick kind of routine that you can do for hip mobility if you have certain kinds of hip pain, kind of following a similar series to my last few videos. So this kind of routine that I'm going to show you guys is oftentimes an option for people that experience a lot of hip pain with general movements of the hip, whether that's neurogenic, so nerve related, or muscular, so on and so forth. This can often be a way to actually to help train the muscles of the entire hip complex without actually moving your leg too much and causing pain. So what this is called doing isometrics. Isometrics themselves is a very well studied training modality in the exercise world. It's taught a lot in universities, and it's a way to elicit muscular contraction without the muscle actually really moving a whole lot. So what an isometric pretty much means is you are pushing or pulling against something that is immovable. So for example, pushing against the wall or pulling against a pole that will not move, as Coach Luna comes to agree. She isn't a big fan of isometrics personally, but so isometrics are pushing or pulling on something that will not move. So for example, pushing into a wall as hard as you can, that wall isn't going to move. When you're pushing against it, all the muscles that are involved in pushing are still firing and contracting. So you can use isometrics on really any muscle group if you know how to do them properly. Sometimes for people, if you're working on pulling power, we'll let someone to pull against something that will not move to work on their pulling power. So you pull as hard as you can and it will not move. So for someone that's experiencing hip pain, regardless of where it is from, this can be a method to help get increase the blood flow, get the muscles in there firing a bit, without actually having to move the leg too much and cause too much pain. The goal of isometrics is always to apply maximal or close to maximal force into the unmovable object, but it's totally a beneficial thing to do at less than maximal force too. So even if you're pushing or pulling to something at 50%, that's still good because you're still getting that muscle contraction. So for the hip specifically, I'm going to be showing all of the planes of motion for the hip. So we'll be doing hip flexion, we're doing hip extension, we're doing abduction, we're doing external rotation, and we'll be doing internal rotation. So some of these have more than one way that you can do them. Some of them are done seated, some of them are done standing. There's lots of different options out there, and this is often a way I'll do tests with people. You put your hands outside of someone's knees, you get them to spread out their legs. You'll see like people push into your hands, right, and you resist. So you can see how strong that their external hip muscles are. Same thing internally, people pushing in and you resist. Same kind of a concept. So the camera view is a bit different because I'm going to be using this wall here for all of the movements. I do recommend doing this, bilaterally on both sides to keep things even. Unless you have one side that is significantly more weak than the other side, then obviously focus on that side until things begin to bounce out of it. This routine shouldn't be used to diagnose or treat any specific medical condition or injury. It's simply an example of exercises that are often used, at least in my practice, with people that have certain kinds of hip conditions or injuries present when the mobility aspect is the hard part. So as usual, if you're new to physical activity, if you're returning to physical activity from a long layoff, or if you have a medical condition that might make doing physical activity difficult, please consult with a physician prior to beginning any new exercise program. Thank you. So, to begin, first one we will start with, we will start with what is called internal rotation. So internal rotation is you take your femur bone here and it's turning inwards, so it's going this way. So my foot might be going outwards, but the actual femur is rotating inwards. in towards the midline of my body. So internal rotation and external rotation. So for internal rotation, when you bring it in, you're actually contracting a lot of the muscles on the inside of your hip. So your adductor muscles adding to your body, and those internal hip flexors, or sorry, yeah, a hip flexor muscles that to curl things in. You remember, muscles pull. Muscles don't actually push. Muscles simply pull. So do internal rotation using these muscles here that are often weak on people. This is an often way where you can tell, you know, range of motion difficulties or weaknesses in people. You go simply, you're going to externally rotate, externally rotate. See, I'm roughly equal on both sides of active range of motion. Passively, if someone moved it, I'd probably have a little more, but this is a tight area for me personally. My internal rotation is not very good, right? Coach Luna knows this also. So to work on the internal muscles of the hip, one of the ways that we are going to do it is we're going to come right against the wall here. So you see my legs right against the wall. I'm sitting as close as possible, and I'm going to do the same motion. I'm going to go like this. So I'm going to internally rotate into the wall. With the wall here, my foot isn't going to be able to actually go anywhere. So if I push, so right now I'm trying to do it. I'm trying to turn my leg in. We'll go 10 seconds. 6, 5, 4, 3, 2, 1, and done. Now you see, I felt that in the muscles of my hip there because I was forcing it into it, but it's not actually moving. So you just go there, you rotate it, I'm pushing hard. You can do that for 3 sets of 10 seconds, something like that. I was pushing at about 80% there. If you want to do 90%, 100%, fantastic. If you start at 50%, it's totally fine. It's just a good thing to try and progress on over time. So that is internal rotation. So for the next one of what we will do is we will actually work on external rotation. So for this one, there's a couple different ways to do this one. The way that I will generally show it is, you know, I will hold the person's leg down or partially single, and their goal is to go like this, and you'll bring it up. But for this one, what I'll do is I will take my foot and I will block my other foot. So my left foot is now blocking my right foot. And my goal with my right foot is I'm trying to go like this. I'm trying to go like this movement, but with my left foot there, I won't be able to. So doing this, you're working the external muscles of your hip out here. Your external rotators. So this is external rotation, right? So the femur is rotating outwards, outside of the body. Internal rotation inwards, outwards is outside. So external rotation. So we'll do the same thing. I'm going to try to go like this with this foot blocking it and begin. So 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and done. See? And even with that, I can feel that contracting in my outer hip here. Sometimes it's easier, you know, if you try to feel the muscles and you can put your hand on them while they're working. It helps you build up that, you know, mind-muscle connection a little bit that people often talk about. So that's external rotation and internal rotation. So those were kind of the small intricate muscles of the outer hip and the inner hip. So next, what we'll do is we will go to standing lateral abduction. So I'm going to be standing here. I'm going to be standing up, so you won't see my face, but I do show this in a lot of videos. This is one where you're standing. You're going to abduct your leg, so your leg goes straight out to the side. But this time we're doing it into the wall. So you're pushing into the wall there. So same thing. We're going to stand up right against the wall. Put your foot right against, and I'm trying to extend my leg into the wall and begin. 10, 9, 8, 7, 6. Now this way. 5, 4, 3, 2, 1, and done. Whew. So see, even something like that. I'm simply trying to do this to this movement into the wall. It allows the muscle to contract. And you can even work at it in different parts of the range of motion too, right? You can do it here if you want. You can step a little further back, so now your leg's there. Same thing. There, right? So it changes the actual, you know, contraction of the muscle slightly because it's more contracted when you're doing the isometric. So just different ideas. So that is abduction, right? So your leg is being abducted. Alien's taking your leg away from your midline. You're bringing your leg back, and that's adduction. You're adding it to the body. So for an adduction movement, similarly, what I will do this time is, so we will adduct this leg. So I'm trying to bring my leg inwards. So this one, I'm going to dip my knees just a little bit.
going to straighten this leg out to the side. This leg's currently going into the ground, so I'm not going to be able to really bring it in. But I'm going to try to bring it in. So we go and begin. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and 0. So that whole time I was trying to go like this movement, but my leg is stuck on the ground, so it's not actually going in, but you drive. And that works all the muscles on the inside of your leg there, your adductors, your internal hip flexors, your internal rotators. It's another great movement. So the last two planes that I want to show you guys is hip flexion and hip extension. So just to show you guys what those are, so hip flexion is taking your leg and bringing it up. Hip extension is going backwards. So this is extending, opening up the hip, flexing, shortening the hip. So your hip flexors are on the front of your hip here, and your hip extenders are on the back. So to work the flexors up front here, what we're going to do, we're going to bring our foot right into the wall here. So my right leg is into the wall. Now, what I'm going to do is I'm going to push my foot into the wall, just straight, like I'm trying to go like this, but my foot is already on the wall, so it can't go anywhere. And begin. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and time. Woo. So let's work on all those hip flex muscles that are doing this movement. Now we will do the extensor muscles on the back. So similar concept. Put your foot on the wall there, and what I'm trying to do is go like this. My leg will be in the wall so that it can't go anywhere. It's on the wall. Go 10 seconds and begin. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and done. Woo. Alrighty. So that is difficult. So doing those type of movements, all these muscles in here for a lot of people are quite weak, and it's very important to work them. And that's just another simple way to work on using those muscles more effectively. So there's lots of different ways you can do these still. Hands on your side, trying to spread your legs out. Hands inside, trying to bring your legs in. Lots of different ways. You can put your hands on top, try and raise your knees up, right? Tons of them. But those are just a basic few that I wanted to show today. So I often recommend people doing each of those for 10 seconds for 3 total rounds. So each of those movements you hold for 10 seconds, rest maybe 15-20 seconds, another 10 seconds, same and the same thing for 3 total rounds for each exercise. And it's a great way to help work the whole hip complex without actually moving it a whole lot. And oftentimes after doing those things, it can loosen things up a bit to where you're able to move your hip a little bit more. So I hope you all found that helpful. If you have any questions, feel free to post them down below. My name is Adrien. I'm the exercise specialist at the Leduc Beaumont Devon Primary Care Network. Thank you so much and have a great day.